if the problem is from the nerve root itself, okay, from the spine, they might have one or two symptoms of the nerve root, and it will be very clear, okay, such as, if L5 disc is involved, top of the foot, will be numb, L4, big toe will be numb. But with piriformis syndrome, there's the pain all over the leg, and they're global symptoms. Most people will say, I feel like this right here is being compressed. Okay, and it's very easy to check. You just do the straight leg test. Straight leg should be negative with piriformis people. And you lay them on their stomach, and you do this in order to stretch the piriformis. Okay, and that's positive. Any questions? Susan, you had a question.
I don't remember now.
Sorry. Okay, they're both fairly easy to treat, and when we go over there, I'll show you how to treat those. Now, the third problem we're going to talk about today is osteoarthritis of the hip joint. Now, the name suggests that this problem happens to who?
Older people?
Older people. Okay? It's very uncommon to see this in younger people. Okay? But in older people, it's very common. What's their symptoms? Who can tell me? Guess what their symptoms would be.
I heard stiffness in the morning. Stiffness in the morning.
Stiffness. The primary thing. If those people walked into your office, how would they walk?
Straight, without bending. No? Oh.
I don't know where, but that happens. A lot of people that have osteoarthritis of the hip, okay, and they're surgical candidates, they have this. Okay, they cannot strengthen all the way. Okay. I've thought a lot about it. Why would they walk like that? And the only thing that I can come up with is when you go like this, you take weight off of those.
I think the other reason is that they're stuck.
Yeah, they're stuck
sleeping,
also. Yeah. That's the stiffness is the primary thing. They're stuck. But when they walk, they're like this. I think it's because it takes weight off them, okay, off the hips. A lot of them will have iliopsoas problems. A lot of them will, you touch the iliopsoas muscle and it's just they'll jump off the roof. So when people come into you like this, don't automatically assume that it's a hip problem. Check their iliopsoas. The way you check iliopsoas is you put them on their back, you raise one leg, and the other one should just be straight. If you raise one and the other one comes up with it, the iliopsoas is too tight. Okay? In a clinic, hip arthritis, when they come to you, it's not an easy thing to treat. Okay? It's a hard thing to treat. It takes a long time. Okay? But you can get very good results with them. Okay? At least what you can do is if you can postpone the surgery. Okay, let's say they're 50 or 60 years old, okay? Hip replacements generally have 10 to 15-year-old lifespan, okay? The replacement itself. So that means if they get a surgery at 50 years old, okay, chances are that they're going to get another one at 65. Because if they don't, they're going to wind up like Jeff. They're going to constantly hit themselves with their hip, okay, with hip dislocation. But if you can treat them, if you can prevent severe damage to the hip, and let's say their first surgery is at 65, well, then you save them shed a little money. Sorry for the lingo. And also you save them less surgery. Okay. With hip arthritis, this is the joint that is going to be affected. Okay, if you try to do rotation on those people, it's going to be very painful. Okay, however, guess what? That is the treatment for it. What's osteoarthritis? Osteoarthritis, you get little bumps in here, okay? Joint should be very smooth, right? See, and then you have this joint. And it's in here and it's moving, and there's this liquid here that's 40 times slicker than ice. Okay, synovial fluid. Now, with osteoarthritis, what you'll have is the cartilage will wear off. It will be worn off, so the cartilage will be gone. Okay, and this bone will have tons of bone spurs on them. Okay, so it'll look like bumps. It will not be smooth. So every time it'll rub against each other, okay, it'll cause pain. Now, why would your body not do this to you? What's a bone spur? Bone spur is a necessary mechanism for your body to protect itself from a fracture, right? Where do bone spurs happen?
All this friction.
Weight-bearing areas. Bone spurs happen cervical spine. Okay. Bone spurs happen lumbar spine. They happen in hips. Okay. They happen in knees. They happen in feet. Okay. You guys have heard of people walking, with heel spurs, right? Why? Because your body detected that if I don't put more calcium in there, it's going to break, or it's going to get damaged. So what it does, it puts more calcium. Bone spur is not a pathological problem. It's a normal wear and tear of the body, normal protection of your body. Now, why it becomes a problem when it's close to a tissue or a structure or a nerve, okay, that supplies somewhere. Let's say, for example, you have a bone spur, at L5, S1 area, right? It's okay, it's a bone spur. But if the bone spur is big enough and it's compressing your spine or your nerve root, well, now we've got a problem. Okay, but if you have a bone spur that goes anteriorly and there's nothing there, have you guys ever looked at pictures, x-rays of people that are, 67 year old, lumbar spine or neck? You have?
No, but isn't it curved?
Yeah, it's curved. But this is a normal, let's say, joint, right? So this is a normal joint. Now, if you look at people that have osteoarthritis, this is what it looks like. Okay? Like this. Some cases here too. Okay, this is what it looks like. Those are all bone spurs. What your body does is broadens the area of weight bearing. Okay, if this bone spur happens here, it's a problem. Okay, it's going to compress a nerve root, or going to compress the spinal cord, or it's going to do some damage. If it happens on the anterior side, okay, which is towards your stomach, most likely it's going to be asymptomatic. Okay? Now, one thing though, when you look at x-rays of young people or people in their 40s, 50s, that do have this, okay, you want to what is it called? It's an aortic problem. It's from the aorta. Okay? Aneurysm. Okay? Aortic aneurysm can cause this too in the lumbar spine. Okay? Because it hits it's really big. So it'll hit the lumbar spine, boom, 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 every time the heart pounds. So it'll cause damage. There'll be calcium deposits there. Okay? When we treat hip problems in the clinic, like I said, it depends what you're treating. Acute problems generally are easy to treat. Chronic problems are hard to treat, okay? If you get people with osteoporosis, osteoarthritis of the hip, they're very hard to treat, okay? They have to be under your supervision for quite a time, okay? Any questions so far?